Our next speaker is Dr. Kristen Harknett. Dr. Kristen Harknett is a sociologist who helps lead the SHIFT project that investigates inequality and job conditions in the service sector. Her research asks a critical question: when workers don't know their schedule week to week, how does that unpredictability affect their health and their families? Over the past decade, the SHIFT project has linked survey data from hourly workers to their employers, revealing how workplace conditions drive health and inequality. And before Dr. Harknett takes the stage, we'd like you to hear directly from a worker who's living this research. Her name is Imelda, and we'd like to hear from her about what her schedule instability looks like day to day. And then Dr. Harknett will take the stage and present the data behind those experiences.
Mi nombre es Imelda y trabajo en el McDonald's de la 63 e Internacional aquí en Oakland ya por 20 años. Y pues el horario para mí, así como me lo han puesto, es muy complicado porque yo tengo mi niña de 12 años que tengo que llevarla a la escuela y se me hace difícil. O recogerla en la tarde también muy tarde. Tengo que andar pidiendo a quien me ayude. Pues a mí me gustaría que me dejaran el horario que yo tenía antes, pero no, si quiero trabajar tengo que ser flexible para que me puedan estar dando más horas. Yo nunca trabajaba a las 2 de la tarde para salir a las 7:45 a la noche, pero si no voy a trabajar así, no me dan más horas y yo necesito dinero. Pues a mí me estresa mucho, mucho estrés porque pues tengo que pensar cómo le voy a hacer para llevar la niña a la escuela, quién me la va a traer de regreso, o como alguien quien me la lleve, como hoy que entro a las 6 de la mañana, tengo que buscar quién me la lleve. Y sí, pues sí es complicado porque no tengo un horario bien para yo acomodarme con mi... Sí, la semana pasada me llamaron a las 5:06 de la mañana, que si podía entrar a las 6 de la mañana. Y pues me levanté, yo todavía me sentía hasta como mareada de que estaba dormida cuando me llamaron y me levanté, agarré mi ropa, me metí a bañar para llegar a las 6. Hay veces le llaman a uno, la otra vez me llamó que si podía ir a trabajar, le dije no puedo, le dije estoy haciendo de comer. Me si faltan 2 horas, le dije no puedo, estaba haciendo yo, nosotros decimos menudo, le dije no puedo, pero si alguien no va, entonces es cuando a nosotros nos llaman. Yo pienso que así como ellos, los jefes piden que uno, cuando va a pedir uno un día, que lo ponga uno 2 semanas antes y ellos le llaman a uno de un ratito para otro, porque alguien no va, ya entonces sí, andan buscando a ver quién va y quién va. Gracias a ustedes por preocuparse, por tomarse el tiempo con nosotros. Sí, es que sí hace falta que haya más gente que nos escuche que lo que pasamos en los trabajos. Y pues tenemos que aguantarnos, pues si queremos trabajar y tenemos familia.
I am so grateful to Imelda, who we just heard from, for taking the time to share her experiences. It's really an important reminder to me why I'm doing the research I'm doing, and I think to all of us, the stakes. So for the past 10 years, I've co-directed a project called the SHIFT Project, along with Danny Schneider. And the SHIFT project has focused on the prevalence and the damaging consequences of scheduling conditions like Imelda just described. And in the state of California, over 3.3 million workers are employed in the retail or the food service industries. These jobs represent a sizable share of California's workforce. In most counties, it's upwards of 20% of all California workers are paid by the hour and employed in retail or food service or accommodations. And the state of California in many ways has led the way in terms of raising the floor on labor conditions. California has raised wages for workers in all industries, with the minimum wage now $16.90 statewide, substantially higher than the federal minimum, and even higher in the Los Angeles area, the Bay Area, San Diego, and here in Sacramento. Also, the FAST Act raised the minimum wage for fast food workers in California to $20 per hour. And these wage increases have been a very important step in improving job quality for California workers, but wages are not the only important measure of job quality. And what we heard from Imelda is that a work schedule is an essential component of not just job quality, but quality of life. And having the notice and the predictability to plan your life and to plan your child's care is crucially important. And many workers in California deal with rampant instability in their work schedules and their work hours. We interviewed workers last year, about 100 workers, and heard about how their schedules make it extremely difficult or even impossible to plan their lives. A Starbucks worker told us that they only get their schedule 2 days before. How am I supposed to plan my life, they say. A Taco Bell worker tells us that they only find out that very same morning whether they're expected to work that day. And a Burger King worker told us that their schedule was a roller coaster, that there was absolutely no consistency. Workers also complained of chronically being underemployed, not getting enough hours to make ends meet. A different Starbucks worker described their fight, their struggle to get enough hours. They often came up short, and this had consequences for their ability to make rent. These kinds of conditions, this underemployment, this rampant instability, leads workers to really give up their free time in addition to their time on the clock. So a Dollar General worker described to us how they always stay open and available for work at any time. Their manager even going so far as to ask them, keep your phone on, I might need you. And the worker says, I'll always go in because I always need extra money. Now, these workers and Imelda are unfortunately not exceptional cases. The challenges they describe are quite common. So even in California, that's really led the way in a lot of domains of labor protections. In California, in the retail and food service sector, half of workers still are not getting 2 weeks notice of their work schedule. And even once schedules are set, over 60% of workers say that their schedules are shifted around at the last minute. They might have to come in early, stay late, or work a different time altogether. A quarter of California workers have to be on call for work. And that means that they hold their day open, they call in the morning, and if they're not needed for work, they receive no pay, even though they've foregone other opportunities to make plans. Two-thirds of workers say that they're expected to keep their schedules open and available for work at any time should their employer need them. And almost 3/4 say they wish their schedule was more stable and more predictable. And more than half of California workers in retail and food service want more weekly hours than they're getting. And our research has shown that these schedules have enormous consequences. First, for economic security. So paychecks are determined not just by your hourly wage, but by the number of hours that you work. And unpredictable schedules interfere with workers' ability to supplement their income from their service sector job with second jobs. They can't plan that. And it can make it difficult to do the kind of planning that allows one to be thrifty. And workers with more precarity in their work schedules, those that get less notice and have more of these last-minute changes, are much more likely to report serious hardships like hunger and housing insecurity. These schedules also have serious consequences for workers' mental health. They take a brutal psychological toll. And we find that workers who contend with these volatile schedule conditions experience a great deal of psychological distress as a result. Unpredictable schedules are also terrible for sleep quality, which itself is a hugely important determinant of health. And we found in our research that having an unstable and unpredictable work schedule is actually even worse for sleep quality than having to work a regular night shift or being the parent of a young child. And so many of us know that having a young child is a serious impediment to sleep quality. Unstable work schedules are an even bigger impediment. And unstable schedules have consequences not just for the workers themselves, but for their families and for their children. So we heard from Imelda how her schedule made it very hard for her to get her child to school or pick her child up. And in our research, we've seen that the instability that working parents experience in their schedules unfortunately gets passed on to their children. That children whose parents have unstable schedules experience more instability in their child care arrangements, and we also see connections between these volatile schedules and children's behavior, children's acting out or acting withdrawn. Recognizing the havoc wreaked by unpredictable work schedules, some localities have passed Fair Work Week laws that entitle workers to advance notice of their schedules or to extra pay if they're asked to work on short notice. These laws also regulate back-to-back closing and then opening shifts, having to close the store and then turn around and come back early in the morning to open it up. These laws regulate those kinds of shifts that can interfere with sleep. And these laws also attempt to combat involuntary part-time work through an access to hours provision that says before an employer can go out and hire more and more part-time workers, they have to first offer extra hours to their existing part-time workers. A few California cities have passed Fair Work Week laws, first in San Francisco, more recently in Los Angeles and Berkeley. And in San Francisco and in Emeryville, these laws cover hourly workers in retail and food service. In Los Angeles, these protections only apply to retail workers at this point, and Berkeley has the broadest coverage. And our Shift Project research has shown that these Fair Work Week laws really do make a difference. They're an effective tool for stabilizing work schedules. And in our most recent research on Fair Work Week laws, we study Los Angeles and how that law made a difference for retail workers, finding that the Los Angeles Fair Work Week law reduced the experience of having your schedule assigned on short notice, also reduced exposure to on-call shifts, shift cancellations, and those back-to-back closing then opening shifts. Yet, in spite of California's leadership in labor regulations, including with innovative Fair Work Week laws, most California workers are still not covered by these protections. Even in retail and food service, where these laws most often apply, 84% of California workers are still not covered. And research shows that Fair Work Week laws improve schedules and also then have additional benefits in terms of reducing economic hardship, improving sleep quality and mental health, stabilizing children's lives and routines. And there's also evidence that more stable schedules have benefits for employers too, in terms of reducing job turnover, which is very costly from the employer perspective. So we found that Fair Work Week laws are an important tool for improving the lives of California workers, and expanding coverage and improving compliance with these existing laws would have widespread benefits for workers like Imelda and millions others like her.